Let's talk about that with Dr. Rondi Kathleen Walker, a board-certified plastic surgeon who is the founder of Walker Plastic Surgery. And I've got to ask you, first of all, have you had any clients come in wanting to look like what they look like on social media?
I've had a few, mostly the younger patients, and mostly, I would say, younger male and female, and mostly for people who desire rhinoplasty or to have their nose shape changed.
And what do you say to them? I mean, if somebody just wants a nose job, I mean, there can be a whole host of reasons why they want to do it.
Right. Well, it really depends on what they are asking for. And usually in the age range that I'm speaking of, they're between 12 to 17, sometimes 18. So they're usually coming in with a parent. And usually it's been either a breathing issue or a problem with, their nose that they just don't like. And sometimes it's very real, and sometimes it's causing them some psychological damage. And what they're requesting is very reasonable. However, I cannot always deliver what they are drawing up or presuming to be their new identity on Snapchat. So I tend to either have them speak to previous patients of mine or go through my own photographic books of pre- and post-operative photos, and then I will take it from there. Now, if I really feel somebody is really, just this is not going to do it, I explain and I speak to them. But the nose is one thing for the younger population. The older population tends to be, probably in that age group that I just discussed, between 12 to 17, is probably 2.2% of females and about 2.5% of males. But as they get older, the proportion tends to change a bit, and we tend to see more females. And a lot of it is after either childbirth, or they gain a little weight, and they'll obsess about, one body part or the other. Now, a lot of people will have some, just be concerned about a body part, but to obsess and, signs like looking in the mirror constantly or constantly comparing yourself to other people. There are a variety of signs and symptoms.
There are a lot of signs, but do you think it's coming from the fact that people are posting themselves on social media and comparing how they look to other people on social media?
I think for the younger generation that is true. I would say for people over the age of 25, they tend to get it more via not Snapchat necessarily, but other types of social media. Facebook, for example, or Instagram, but also from fashion magazines, because the fashion magazines do thin down people and do show them at their best shots. And if you see those untouched photographs, these people look, far more like you and I.
Dr. Walker, do you talk with your patients about where they're getting their ideas about what their ideal body part or type should look like?
I absolutely. Yes, I absolutely do. Usually I just start the discussion with, why don't you just tell me what's bothering you? And especially if they're younger, I want to know if they've been teased. I want to know if they've been bullied. I want to know if there's, something that's a social issue that's going on. Because in addition, these patients also have a great deal of anxiety and depression, and a lot of times they even have a significant OCD factor. So it all can blend together. So even though I am not a psychiatrist, I deal with a lot of people and a lot of patients. So it is my goal to give the best surgical treatment to people who really can use it and appreciate it and, not be upset with it. Because just as if you go in and operate on somebody and they're really don't have, great indications for surgery, they might be even more unhappy after having the procedure done. And that's something that I really discuss with them thoroughly, especially the younger patients, and especially in front of their parents.
All right, Dr. Rondi Kathleen Walker, thank you for your expertise on that.